Well, good afternoon, everyone. Today is July 12th, 2023, and it is 2:02 p.m. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Budget and Finance Committee. As a reminder, some of our committee members may be also participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. The first item of business is public communication. Members of the public who wish to make comments virtually during the public communication portion of the meeting must have registered with Central Health via the online form or by telephone no later than 12:30 p.m. today. Yasina, did anyone register to make any comments for the Budget and Finance Committee?
We do not have anyone registered to make public comments.
Thank you. Thank you all. We will now proceed to the committee agenda. Agenda item number 1, discuss concepts proposed by Travis County for Central Health to fund some or all healthcare costs for adult inmates within Travis County jail system. At this time, we will welcome Travis County Sheriff Sally Hernandez and Travis Gateman. Travis County Budget Director will be presenting.
Yes.
Thank you and welcome.
Thank you, Dr. Bell, board members, Mr. Giesland, Travis Gatlin I'm the Travis County Budget Director. Thank you for the opportunity for us to be here. As you mentioned, Sheriff Hernandez and her team are here to, if you've got any detailed questions. You know, these are inmate health care we've discussed with Central Health really for quite a while, since early on its inception. And if there's ways that we could partner, do things better. I think we're experts in operating the jail and doing the things in the jail, but any type of healthcare expertise has always been welcome. Other counties have a little bit different models than Travis County, and I want to kind of briefly talk about that with you, and then just explain the kind of complexity of our operation, see if you've got some questions, and then we can kind of just brainstorm and talk about it at the end. And so based on my research, I found for urban counties, I found 3 models. The first is Travis County, and that's where the county, through the sheriff's office, pays for all inmate health care in the jail and outside of the jail. Dallas and Bear, their health care district, pays for all inmate services, inside the jail and outside of the jail. I would also say a little bit different in that all the other counties I'm going to talk about have a public hospital. We're a little bit different the way our hospital is structured. And then El Paso is a hybrid model where the healthcare districts of Harris County and El Paso pay for inmate healthcare outside of the jail. I believe they provide services inside the jail, and the county reimburses the healthcare district for the services inside of the jail. And this information is probably about a year old, so if there's been any changes to it, we need to go back and circle back with everyone to do that. I'd also add that I mentioned we don't have a public hospital, but also important for the sheriff's office is there's not a secure wing in any local hospital, and that creates some challenges for us as far as having to provide 2 correction officers on a 24/7 basis for each inmate for safety for the inmate, the officers, and those in the hospital. And that also applies when we do outside medical care. And I'm going to talk a little bit more about that and what the cost of that is. Essentially, the jail is a very small city. There's as of roughly in the past week, there was a little bit under 2,200 inmates in there. That includes about 1,900 males and about 275 females. And 42% of the population, or 913 inmates, had some type of mental health designation. We believe that Travis County is the single largest provider of mental health services in Central Texas. The Commissioner's Court, part of what's been the impetus for this discussion is the Commissioner's Court's been wanting to explore a diversion center and finding ways to divert people from going to jail that have mental health challenges, that have charges that suggest they can be safe in the community. They just need a place to go to. And then obviously when people get out of jail, if there's ways they can be connected with services so they don't return to the jail for those people. Average length of stay is 28 days for all inmates, but if you stay over 3 days, the average is 57 days. So there are some long-term people that are in jail. And the sheriff's office by statute does provide all healthcare services that they require in jail. And we'll talk a little bit more about what that looks like. There was approximately 26,000 bookings last year, and each one of those bookings includes a medical and mental health screening. On average, during the past year, monthly, there were 28 hospital admissions, 63 transports each month, and 72 outside appointments. There's also 132 inmates awaiting a state jail hospital bed, and that's on average for this past year. And again, each of those admissions, emergency room transports, medical appointments requires 2 correction officers for safety. The sheriff's office budget for next year, which is in draft form right now, is about $225 million, but it includes $22.7 million for medical and mental health expenses. That includes $15.6 million for medical or mental health personnel that are sheriff's office employees, and $7.1 million for medical costs like outside medical care, pharmaceuticals, and contracted medical and mental health services. Those costs don't include the cost of transportation to take inmates again to those outside medical visits. That's just the direct medical staff and some administrative staff. Going in a little bit deeper dive on what the $15.6 million for personnel. It includes staffing both at the central booking facility and at Del Valley. At central booking, there are 17 related medical FTEs, predominantly nurses, and 5 mental health positions. Those are counselors. All told, and those numbers are included in the 77 total medical providers, which is LVNs, nurse practitioners, physician's assistant, a physician, pharmacist, pharmacist tech, x-ray tech, supervisors, and 42 mental health providers, which is a psychiatrist, a psychologist, trauma-informed care coordinator, and some clinical mental health professionals. And again, we also contract with Integral Care for additional mental health services. Moving on to the next slide. For the budget for next year, I mentioned it's $7 million, and that's for outside medical care, along with pharmaceuticals and other services. I kind of want to walk you through that. So the outside medical care, which is mainly hospital visits and ER visits, excuse me, that's $3.2 million. Pharmaceuticals is approximately $2 million. I would add it's a 340B waiver. We are not eligible for that special discount. If there's ever ways that we could partner with another agency to help us get that lower pricing, that's always been something we've been hopeful to figure out. Contracted nursing, the contracted nursing number is fairly low, $119,000. You're going to see that the actual expenses are much higher, and why that is whenever we have a vacancy in a nursing position, we use those funds and contract outside with nurses. But the cost of a hourly rate for contracted nurses is significantly higher than when it costs for the county. But we've had challenges in making sure that all the positions have always been filled. We're doing a better job of that by changing our pay scale, but always challenges to make sure that we have the nurses we need in place. Contracted mental health services, that's about $1 million. The vast majority of that is a contract with Integral Care for a psychiatrist and other services. Other medical contracted services, those are services that contractors provide in the jail, and that could be dental services and other services. But again, most of the expenses for outside care are in that $3.2 million number provided at the top. And again, that's outside the jail where we have to do transportation. And then there's miscellaneous other operating expenses of $400,000 or so. The next slide just shows just the historical spend on those outside medical care expenses. Again, the budget's next year $3.3 million, and you'll just see that it varies by year, but it's been approximately around that $3 million. And so far, year to date, we've spent about $2 million. Reminder, there's no secure wing in any hospital for Travis County. We need 2 correction officers to supervise each inmate while in hospital or receiving outside medical care or during transportation. We talked about the supervisory cost, and so we estimate that for a 24-hour period, for 2 officers to watch 1 inmate, it's around $2,800 a day. And that ranges depending on if it's straight time or overtime. But again, so we've got 73 emergency room visits. At any one time, we probably have about 6 people or more in the hospital. And so that's the round-the-clock supervision that they need. I know I'm moving quickly. Does anyone have any questions so far? Okay. All right, so wanted to highlight the roughly $3 million for outside medical care. $2.2 million is Dell Seton Medical Center. There's some diagnostic services, and then there's other various Seton-related charges. And then there's also 388. It's probably about 40 to 45 different vendors. We don't have set contracts in place with these providers, and so in general, we negotiate the price on a case-by-case basis. We certainly try to reach the savings we possibly can with each bill, but there's not contracts in place that I think guarantees that we're getting the best possible price for these services. Moving on, I'll just touch on those. The next slide is about just historical operating expenses, so you can see what we've been spending by year. One item of note is if you look at contract nurses, you'll see that in 2021 it was $700,000, and we've seen a big spike kind of towards the middle of COVID, and that was just related to the difficulty and expense of getting contracted nurses. So we have a greater need, and the cost is higher. And again, we had greater need because we had some vacancies. We're trying to fill those vacancies, but I think contracted nurses is still always going to be a challenge for us to, given the expense. And if there's a better way to do that, or if there's service providers or partners you have that we can explore that with, we're open to doing that. Moving on to the combined expenses. So we gave you a snapshot of the outside, and then here's the history of what we've been spending on pharmaceuticals, contracted nurses, and other items. And I know, moving on, I know you had some questions, and so one of those questions was, does TCSO have dedicated staff to administer medical contracts? We believe it takes about 4 FTEs to administer the medical care contracts, including medical billing. And I would also add there's also an additional person, at least a full-time person, in their finance division that also works on these services. Does TCSO have a single contract for medical and mental health services? We do have contracts with partners, but again, most outside medical providers are billed for the cost of service negotiated by TCSO on a case-by-case basis, and not through contracts. Is an assessment done while incarcerated to determine if inmates qualify or have a third-party payer for healthcare? Presently, we don't do this. I did share with Dr. Bell and Mr. Giesland that our pretrial services department, upon the booking process, there's a financial and indigent assessment done, and so I think we could use that and share that with you if you were interested in kind of seeing greater details. But I mean, the assumption has always been that the vast majority of people in the jail are very likely indigent. And has there been a medical assessment? That we haven't had a third-party review of our medical services, and we're certainly open to partnering. I think we would need some outside assistance for that, but I think that would be a very valuable thing to do. So again, I'm bringing this forward because Judge Brown and his chief of staff, Kate Garza, and I met with Dr. Bell, and we're just talking about all the future plans for a diversion center and knowing what those costs are going to be like. We explained that we're under the 3.5% revenue cap, and so we're going to need to slowly build up resources for what those services look like over time, year by year. And that led into discussions more about what does the Travis County Sheriff pay for health care? How do other counties handle it? Are there any of these services that we could partner with Central Health and your contract providers? And is there a better way to do things? Better outcomes, more cost effective, all the various things so not our wheelhouse, but certainly want to discuss them with you.
Thank you, Travis. Really appreciate your coming before us and your presentation. I am going to take my stab at the first question, then
Okay.
I will open the floor to my fellow members. So the first overall question that I have is, have you done any legal research? Is it within our confinement to provide this care to this population? And I know within our statute, does it specify that we can provide this care for inmates? I know you said there's a large percentage of them are indigent, but what is the percentage? Are they residents of Travis County? Are they not? So that's my first opening question.
Okay. Well, I'll defer the answer to Ms. Brown on the legal aspect of it. I would just say, as far as we could provide data about how many of the people that are in the jail, how many are resident of Travis County. So we can provide that information. I don't have it with me, but we can provide that information with you. As far as the legal ability, we've had discussions with our county attorney about this, and believe there are ways for that to happen, but I will not speak in specifics.
So, as far as any legal research is concerned, that's being addressed by the Travis County Attorney's Office, and they can provide that information to the county representatives, and then the county representatives can then share that with Central Health.
So at this time, there has not been any in-depth legal research?
There hasn't been any in-depth legal research. They are doing cursory research as we speak.
Okay, thank you. I'm gonna move it on to manager kitchen. You're on mute.
Okay, great. Can you all hear me now?
Yeah, we can hear you.
Yes.
Okay, so just a follow-up question. Thank you. It would be helpful to have information about the demographics of those folks that are in jail, just the whole range of demographics, so that we can help us understand what their eligibility might be for other services. So it sounds to me like that's something that you all can provide.
Yes,
Is
we provided just a snapshot of just basic demographics of what the jail population was yesterday with Dr. Bell, Mr. Giesman, but as far as in-depth numbers, let us go back and see. I think I know the information you're looking for, what if they're resident of Travis County, some income statistics, and some other information and if there's any more specifics, please let us know and we can.
Yeah, we need to know the kind of specifics that will tell us what their eligibility might be for the various types of coverage. And so I would defer to our staff can provide you that information more specifically, because it's going to be income, it's going to be disability, it's going to be a range of things. And so perhaps our staff, and maybe our staff has already do that. I can't see if Mike's in the room, but
Yes.
I assume, pardon?
He is.
Okay, great.
Yes.
I'm sure our staff can tell you what kind of information we need to know. And then a question related to that. So I think I heard you say that that there's not a process for determining or assessing any kind of eligibility when a person comes into the jail. Is that done on discharge?
Well,
Is it done at any point?
as far as when someone is arrested, there is our pretrial services as a part of the bail recommendation process, and as far as determining who's eligible to receive a court-appointed defense paid by the county, there is a financial assessment done. It's not done to determine whether or not there may be a different payer for medical expenses. So that would be something we would need to revisit. But the sheriff did share with me, going back to your first question, about 32% of those that are in jail have either reported they don't have an address or list the Arch as their address. And so 68% have an address. That doesn't mean that they're not indigent, but they do provide an address.
Okay, so I guess what I'm hearing you say is that when someone leaves the jail, they're not, there's not an assessment done at that point on eligibility for coverage. For
I
medical
believe
coverage.
that the goal is that when someone leaves the jail, they're signed up through your MAP program.
That's correct.
Upon leaving the jail.
Does that process happen?
Yes.
It does, okay. All right, then, so upon leaving the jail, they're signed up for MAP. Mike, did I hear you say that? Or?
Yes, that's correct. And also we partner, in addition with Travis County Jail, with the Austin Transition Center and supervision monitoring for alcohol-related treatment, as well as SMART programs. So through those three avenues, we're able to get people enrolled in the medical access program.
Well, as part of enrolling them in MAP, do we check their eligibility for other services? I mean, for other coverage?
As a matter of other healthcare coverage,
Yeah.
you mean? So as a matter of course, if an individual, as their eligibility is assessed if they make too much money and then they're not eligible for MAP, then yes, we facilitate those connections to other coverages.
So we don't check Medicaid coverage or SSI coverage?
Actually, we do assist individuals with SSI and Medicaid coverage.
Okay, all right, I just wanted to make sure, I just wanted to understand the scope of the
Yes.
process, so. Chair, that's all my questions.
Thank you.
Well,
We
wait,
can
one other
get back
question,
to
and
you.
this
Yes,
doesn't
go.
need to be answered now, but I would be interested in understanding the statistics about what people are going to the emergency room for. And I'm wanting to understand if they're, the extent to which they're preventable kinds of emergency room visits. But you probably don't have that data in front of you now.
Good question. We asked it. It's for various things, but I think we could probably work on, sorry.
I can actually. Good afternoon, Sheriff Hernandez. We don't have it really broken down for emergency room visits, but just outside medical care. Some of the reasons for the appointments, and we asked the medical director just to, this isn't, it's hands and face is the number one, gastro, neurology, urology, ortho, and eyes are the kind of how they're, some of the things that we're doing outside medical care. But that's not necessarily emergency room visits.
Okay, well, thank you very much, and if we could get some detailed information about the reason for the emergency room visits, that'd be helpful.
We can do that.
Thank you, Chair, that's all my questions.
Thank you, Manager Kitchen. A follow-up on what Manager Kitchen brought up. Has there been any kind of planning, coordination with central health staff on any kind of needs assessment and the gaps within this program?
I'm not aware we partnered. I think that's a very noble goal. And when Mr. Giesler raised it, it was like kind of light bulb went off. Yeah, we need to do that. But I'm not aware of any. There's lots of discussions that have been going place for many years. But as far as a gap analysis or if there's things that we can do better and have a third independent party tell us that, I think we'd be very open to that.
Is there a reason why you've never had a third-party performance review? You've had this program for how long?
Well, we're constantly doing an internal review ourselves, correct? And then we have to pass our inspection every year. So, I mean, we do an internal review, but we have not done an external review.
Thank you. Manager Valadez, do you have any questions?
Well, thank you all both for being here.
Your microphone, please.
Thank you both for being here, and I appreciate the information that you've provided. It seems to me that this is early in the process, I would think, but necessary to occur. As, like you said, Judge Brown and the county commissioners look at the development of a diversion center, and we provide services to those that are less than 200% FPL. You're saying that a good majority of the inmates, both male and female, are indigent, and then which is also our targeted population. And the need I'm not going to repeat everything that they said because I agree that we do need to have a medical needs assessment. I think that it would behoove you, Sally, Sheriff, I'm sorry.
That's quite all right.
Thank you. To have maybe an initial assessment done by your staff. Dr. Brinson, I think, who is our VP, who is not here, if I'm not mistaken, I think she does some work at the Travis County.
She does.
She does.
Mm-hmm. Yeah, so maybe it would be great for us to have a heart-to-heart with her so that she can share with us some of the things that she has observed or improvements that may need to occur in the process. I think that's something that you all are constantly doing and upgrading. But as to how integral care, the diversion center, and central health or community care / community care would be interacting in a possible funding mechanism and provision of services, I personally would appreciate it if there be y'all have a meeting of the minds and how this would work and come up with numbers, possible funding formula or funding sources, if at all necessary, outside our inside and both outside and inside our tax base, maybe grant funded, I don't know. But I think that there is a need. I've dealt with so many people that have been in and out of the juvenile and criminal justice system over my deceased husband's tenure as a lawyer for over 55 years. Going down there, driving him, talking to people that are coming in and out and giving people rides, you know, who didn't have a way to get home after being released. It would behoove us to provide maybe the development to create a model. And just because we don't have a hospital system such as Parkland or the other healthcare districts doesn't mean that we would not be able to provide services, because, as you know, we are now beginning to provide medical services and would be looking at closing the gaps. So increasing the provision of services to our population, our combined joint targeted populations, and seeing how we can help with that. Personally, I'm one of those that looks first to the provision of medical needs, hospital needs, and mental health care needs through our enterprise and through our funding partners, and that would be Integral Care and Guild MHMR, and whether or not, what kind of a job they're doing with the targeted population, because that is improvement. I mean, that we can always improve. Everybody can improve. It doesn't make a difference what it is, but I sure would like to see those kinds of things, models, strategies, processes improved upon and recommended. If we're going to consider funding, consider being a funding source for whatever it is that is created, because it's not in place now. So I'm hopeful that we could come to some agreement, at least an understanding of what the process is, what our demographics are, what the medical needs are, in and out, and then also tie them to the county and the city for social services, not necessarily us, but through the county and the city as to what they are doing for this population that ends up leaving there homeless, okay, or need for severe medical care based on their diagnoses. So, but I want to thank you all both for being here, and just to say that I'm looking forward to continued discussions regarding this and hoping that we can come up with an agreed upon plan.
Okay.
Thank you, Manager Valadez.
One thing I would add too is there's been a lot of planning about what the models of a diversion center could look like. The county representatives, along with Integral Care, have gone to Nashville, Bexar County, Harris County, Arizona. I think I may be leaving some out, but we've already done some, Miami, and done some extensive research on them. And then within the past 2 months, there was a meeting of all the stakeholders, including representatives from Central Health and Integral Care and Community Care at the Center of Lavaca, which is the county headquarters, and people wrote a commitment that they were going to be commit to helping with the program, and lots of discussion. We're likely going to bring in some outside experts to bring all the people together to work on a plan and a model that fits Travis County, and a part of that can be who should do, who's best, who should fund it, who should provide it, all those various things. Because this, again, as you mentioned, it's the same population. People that are in the jail, they're going to get out of jail, they're ending up in our emergency rooms, ending up in needing services from Central Health. And is there a better way to do it, more cost effective with better outcomes? So we welcome that discussion.
And legislatively, it does tell us what was passed in the legislature directs Central Health to provide services to the indigent care, working poor, those that are uninsured in Travis County. So I don't think that would qualify us to cover those that we are inheriting from other counties that are going and placing their patients, but I would think that would be something that y'all would cover under your budgets that you have now. But as for the others that would be deemed eligible to receive services, I would think that we would be able to work on that together.
Well, and I think the commitment from the county would be, there are some expenses that it would make sense that the healthcare district could better pay for. The county would redirect those resources and put those to a diversion center that ultimately would be providing more mental health services, more other services. I think it would be a more humane, fairer, hopefully more cost effective than what we're
Wraparound
collectively doing
services, things like
now.
that.
So,
We have call centers, y'all have, we have promotoras, y'all have nursing staff, support staff, et cetera. You know, let's
Thank you, Manager.
not duplicate services. Thank you.
Thank you so much. Manager McMorning?
Sure, how are you?
I'm well, Dr. How are you?
I appreciate the presentation and also the questions that were included. And I don't know that I have a question, but rather just want to put out there that it seems very interesting to me to explore the overlap, and forgive if I may have missed this reference because I came in late. The overlap between our work with folks experiencing homelessness, the enterprises work with them, and for example, the respite care program, and also the population in the prison, and you know that particular demographic overlap of whom we may be serving already, who, for example, may have been incarcerated and then
Right.
released already, or had a part of a recidivistic cycle or something like that. I'm really curious about exploring that. So looking forward to more demographic info if we get that.
Thank you. Do you have any further questions? Manager Bill?
Yeah.
Manager Kitchen, do you have additional questions?
Oh, yes, just if everyone else is done, I wanted to say I appreciate the questions and the discussion related to third-party review. And what that means to me is more of a, what's the best practice model? You know, because there would be there's the opportunity, as several of our managers have pointed out, there would be the opportunity to determine what is the best way to provide these services. And so, you know, for a partnership opportunity, what we'd want to be looking at is an opportunity also for developing and including best practices for providing these services. I think the diversion center is one of those that is under development, and that kind of process of determining the best way to provide those services is excellent and the way to go. I would think that it would be important also to understand the best practice for providing services for those individuals who are not eligible for a diversion program. So I forget who mentioned this, but someone mentioned or a number of managers mentioned the opportunity to really looking at seeing what a partnership could look like and what that looks like in terms of best practices for these types of programs.
Absolutely. Concur with you. A follow-up that I noticed within your presentation in terms of your contracts, you said that you do not contract.
For outside medical care, there are some smaller number of contracts for dentists coming in the facility and other kind of medical providers. And again, we do contract with integral care for psychiatric services. But again, all the majority of the $3 or so plus million worth of outside medical expenses, they're not existing contracts in place.
And you mentioned majority of inmates are indigent,
Yes.
correctly? So on slide 20, you provide payment to Ascension Seton. Aren't they responsible for that payment? If it's for indigent, why do you, I'm just trying to understand in terms of payments. Because that's their responsibility?
That's a good question. I think historically we made those payments because we were under the assumption that was due to them, because Travis County is currently the model that pays for those services. If we're not doing it, if there's another way to do it, or if we need to have conversations with Seton and with the healthcare district, we certainly want to have those conversations with everyone.
Okay, thank you. Dr. Zamora, do you have any questions? Manager Valdez?
This is just a real quick one. I haven't seen any of your demographic information information other than what was provided today. If there was information that was provided, I would ask that you provide that to all our board members
We will.
so that they can be better informed and be better prepared to ask you more relevant questions. But I've been screaming and yelling for efficiencies in the processes. And thank you, Chair Mustafa, for even bringing up the ascension seating question, because, we're in litigation. But we want to know, with respect to your financial agreements, who's paying for what? What services are they paying for? What are they are being paid for? And what's not being paid for? And is it our population or not? But again, with the understanding that we're going to be talking about Travis County residents, as opposed to those that are shipped here from other counties or other states. And I think that is a possibility, I'm not sure. And also, I know that in other counties, in surrounding counties that are connected to us, we have seen an increase in violence in the jails and deaths. And so I'd like personally to know whether or not we're dealing with any maybe internal issues that might also need to be addressed that would be a major contributor to hospital emergency care visits, etc.
I'd like to just address a little
Please
bit.
do.
So first of all, I want to, first and foremost, brag on the medical and the mental health staff at the Travis County Sheriff's Office. I mean, these are committed men and women, and that serve this population with all their heart. And I will tell you, I mean, during the whole COVID, the pandemic, our jail kind of led the way when it came to just our practices, our best practices. And so I just can't, I mean, most of you, well, not most of you, but many of you know me and know that, my whole career has been involved in partnerships and being involved. And so I really appreciate everyone's questions and the ability to be here, because we want to partner more with you, and we'll be glad to get the demographics and the other questions that you have. I would be horrible if I didn't admit Meg Seville is over my research and planning, so she's jotting down all of that the data questions that you're asking. And then Major Craig Smith is my admin major, who is over the nursing staff, the medical staff, and that you're talking about. So again, those that know me that's my number one thing is partnership, because we have such a great responsibility and a heavy load that we're all carrying, and we have to work together. And frankly, the medical and the mental health at the jail is a very heavy load.
Mm-hmm. And in light of the fact that the legislature insists on capping what counties are going to be able to, what the tax rates of the counties will be, it's going to force us to create innovative and creative models of provision of services, and to partner and to create efficiencies that we hadn't considered before. So I thank you for being here. I think it's a timely conversation, and maybe it's something that may need to be expedited.
So I just want some clarification. So I'm just trying to understand personally the ask from us, because there's a couple different things that has been presented, and I'm going to also allow my other board members to chime in if they have additional questions. Now, what you mentioned funding for inmate health care, and you also brought in the diversion center. So can you please specify clarity? So from my understanding, what you just said, that whatever you're allocating the funding currently, that would probably be shifted. Us will pay. I'm just trying to understand what you just presented.
Sure.
And then your portion will be into the diversion
Sure.
center.
So-
Is that what I'm understood correctly?
Yeah, let me walk you through it. First, we know that Central Health has funding challenges as well, and you're under certain tax rate constraints, and we have a growing population, and we get that too. The first discussion that we had with Dr. Bell was just, are there some, and also just with Mr. Giesland as part of this diversion center, are there some, what are everyone bringing to the table? And so that's the discussion we still need to have. And as a part of that discussion with Dr. Bell, we got into just talking the deeper dive on the expenses that occur in the sheriff's office, and the question raised whether or not it may make sense for Central Health to think about funding some of those expenses, with the understanding that whatever that Central Health within its mission could would be eligible for, meet criteria, statutory, everything, that the county would reserve those funding and commit to funding the diversion center, and that we would partner with all the stakeholders on how that money should best be spent. I think the low-hanging fruit from my perspective is the 3.2 million or so in outside medical care. And so looking back at the models for, I think, Harris County and El Paso, that's where their healthcare district pays for expenses and inmate expenses that occur outside of the jail. You have obviously partnerships and providers, and probably coordinate that care better, probably have it be more cost effective and perhaps even better outcomes. So at least initially, from the finance perspective, is to explore whether or not in the next year or future years, if that would make sense for both entities.
So just to clarify, what the ask is to pay for outside care, is that what?
I think as an initial step, we would like to explore that.
And that
with
is
Central Health.
the estimate that you
It's
brought?
about three or so, 3.2 million roughly dollars a year. And again, the majority of that is $2+ million to Seton, various other Seton providers, along with other outside providers.
And with that, I will definitely defer it to our staff to sort it out and to think, especially with our finance, if it's something that we can or cannot provide, given our current litigation. I just want to be very mindful of where we're at, because in terms of when we bring in essentially and paying for outside. So that is something that I will defer to staff and to legal, that we will wait on their guidance and recommendation.
We are here hopeful that we could think of better ways to do it together, but there's not any expectations, and we know your challenges. But again, we're here to
We appreciate that.
talk that and also get your expertise, the things like the assessment that you raised. We're welcome to that, and we would really need some outside help to assist us with that because we've never done it before, and that's not our area of expertise. So,
Thank you.
And
Manager Kitchen?
Just to reiterate, if I didn't make it clear before, I'm very interested in exploring what kind of partnership might be available. So I appreciate you all bringing this issue to our attention. I also, as our chair just mentioned, I'm looking to our staff to analyze and work with you all on what might be possible. We will need to do we have to have our own understanding from a legal perspective and a financial perspective, as well as a best practices perspective for providing care. So there's a lot of work to be done, and I look forward to our staff doing all those analyses as we proceed.
Thank you. Dr. Bell?
Yeah. First, I'd like to thank you, Travis and Sheriff Hernandez, for taking time to come and present this to us. As many of the members have said before, we're very interested in determining how we can partner to make the diversion center here in Travis County a reality. It's something that's needed, and it's something that is multidisciplinary in the fact that it's not really about just the criminal justice system or the medical system or behavioral health. It's how they all work together to be able to help individuals who get caught in a particular situation, but that may not be the best situation for them. So there's a lot of value to that, and we understand that, and we want to be able to assist in making that a reality. As Manager Valadez and as Manager Kitchen outlined, it's really important that we figure out what we can and can't legally pay for. And so the legal analysis is going to be very important for us. We've gotten slapped on the wrist, so to speak, for spending. And we feel that, you know, our spending should be aligned with what's in the law, of course. And, you know, it's something that, it's a population that needs care, but is it a population that we can legally serve? And that really is a big question, I think, for me, if not for all the other managers, before we can really sort of look at this particular strategy, not putting other strategies, you know, not saying that other strategies won't exist, but this particular strategy is an issue. One question that I thought about when we were talking about why you pay Seton is when Breckenridge was open and doing business, did your patients get sent there, and did you pay does anybody remember paying Breckenridge?
Yes.
You did?
Yeah, and I think, and I was just told, and that, well, Craig, do you want to just say what you?
Hi, Major Craig Smith, the Sheriff's Office. So I was just checking with our Finance Division as far as Ascension and why we pay. And they agreed that because they do consider our population indigent and would provide coverage until they are magistrated and brought into our custody. And it is their opinion that once that person, whether they were indigent on the outside, once magistration has happened and they become our responsibility, they are no longer indigent because they belong to us.
Got it.
And so Medicaid and MAP, in their eyes, does not come into play, and therefore that's why they bill us. Now, we do negotiate any of those billings, as Travis said, to try to get down to a Medicaid rate with everyone, but that we're not always successful at that, especially with specialty doctors when it comes to like orthopedics and things like that, which we regularly deal with.
Thank you. And that's very informative because it's almost as if they sort of change. They're with you initially, but once they become magistrated, is what you said?
Yes, sir.
Their condition or their eligibility changes. And so then they're not, quote, indigent anymore. They're in your custody.
And magistration comes very quickly.
Okay.
So magistration is when a law enforcement organization arrests that person, they have to very, very quickly go before a judge to determine, are we going to hold them or not? And so it's, as Sheriff said, it's very quick in the process, sometimes within hours. And so I think the opinion of Ascension is, well, you all now have them and are responsible for them, and you have money. So you need to be paying for these bills.
But they could be arrested, be brought to the Travis County Jail, determined that for various health reasons, they should not be in the jail rather than the hospital. Correct. They're taken directly to the hospital, and the county doesn't pay for those services because they haven't been magistrated yet.
Got it.
So, wouldn't Medicaid pay for those services?
Not if they're magistrated.
Okay. Continue on.
Chair?
Yeah.
Yes, ma'am.
Yes,
Could-
Dr.
could
Bell's
we-
still
could we ask
asking.
our legal- Could we ask our legal staff if they have anything they want to add about any of this coverage? It may be that they don't at this point, but I was wondering if Ms. Crowley had anything she wanted to add.
Sure. Do we want the Travis County attorneys to chime in on that, or,
No, I think I'd like to hear from our internal staff. I mean, Travis County has their interests that they need to represent here, as does our staff,
understood?
so.
Ms. Crowley, do you have anything that at this moment that you can present?
Mike, if
And I'm gonna defer to our CEO.
If I may, I think if the board is going to seek legal counsel, it needs to do so in a closed session environment.
Okay,
But
that's
also,
fine.
if there's
The reason I ask is there's a lot of conversation happening about what Medicaid covers and doesn't cover. And that's what I meant. I'm not sure if we're kind of
Understood.
getting into the area where there might be some discussion about where the area of the law kicks in on what some of this coverage is. That's all I meant.
Oh, thank you, let's continue on with the questions, and we'll see if we're gonna go into closed session today or at another meeting.
Yeah, that could be another meeting. Doesn't need to be answered right now.
And I also concur with you in terms of legal opinion outside, and this is something I think we would want, as probably others, to seek legal opinion outside of Travis County, because somewhat of a conflict of interest of whatever it is. I think have done it with other projects as well, that we saw external legal opinions as well. So, Dr. Bell, please move forward.
And I just wanted to clarify with you, Travis, we're talking the outside medical services that you had a slide on where Seton was paid 2.2 and Quest Diagnostics, and that's for laboratory services, Seton Medical Center, Austin, and then Seton Family of Doctors. Is that the amount that you're?
Correct. So if the total's 3.1, there's also 388,000 for various providers that we can provide you, but they're, ENTs, various other doctors. But that to me would be initially, because that way, the sheriff's staff would still be in place for all the inside medical care. That certainly would be something we would just, the assessment would be, what can we do better both inside the jail and outside? But the initial discussion, I think the easiest discussion from the county perspective would be, are there some better ways for us to do the outside care?
Okay, all right. That answers that question, and it sort of led to a different question, and the medical staff is actually employed by the sheriff's office.
Yes.
Yes,
right?
sir.
Okay, so they work for the county.
Yes.
Through the sheriff's office.
Yes, sir.
Exactly, okay. And, okay, well, that actually completes my questions. Thank you.
Thank you so much. I want to actually go back to the first part with your with the other counties. It's on page number 13 of our slides.
Yeah, number 2.
Yes, slide number 2. I know that you said this is probably not the most recent data information that you have. Have you had any recent discussions with them?
Haven't had
Have you
recent-
called? Have you
I personally called the healthcare districts of Dallas and Bear and spoke with their financial staff and Harris and El Paso. So and this was about a year ago. I don't anticipate there's been any changes in how the structure works at all. And I've had extensive notes about this conversation. But let me just say things can change, and I don't have up-to-minute information. But I have no reason not to suspect that what's presented here is still what's happening in those other counties.
Yeah, because I personally don't know currently. I know I've once spoke with Harris County, but their model's slightly different. They are really, they were building up, changing their model for inmates. I don't know where they're at. So I think there has been a lot of evolving issue in Harris County around this space. So I'm not apprised of what it is, but there is something going on.
Oh, I can tell you that Harris Health, I think, came into the jail around March of 2022. And so I think you're correct. I think it's been evolving in Harris County.
We certainly would open to getting on some phone calls with our staff, the sheriff's office, and central health staff. I mean, the questions that I may ask from a finance side may be different than what you may ask from a medical side, and the answer that I get, I may hear one thing and you may hear something else, and it could lead to lots of other questions. So we welcome that opportunity.
I think, as all of us, we emphasize collaboration, coordination with others. You don't want to continue on, spinning the same wheel. Like, okay, what have you done? What have worked? And in terms of, I think we've mentioned best practices. I just wanted to make sure that we do definitely support healthcare for everyone, especially indigent. But it is our role and fiduciary responsibilities to be asking these questions, and just want you to know our intention. We support the care, we support the diversion center, but from our end, we want to be able to make sure that what we're doing is legally compliant, and we're doing our best practices and being fiduciarily responsible for our taxpayer money. So just wanted to throw that. Manager Valadez.
Just not to put too fine a point on this, but the consequences of of the jail population on families and society is incalculable. I have dealt with children, with wives, with girlfriends, with partners, and the impact on their quality of life is sometimes devastated by an incarceration. And anything that we can do and work together to make sure that we build a better quality of life, which is part of our mission in Central Health and our enterprise, then I think that we need to do it as soon as we can. And that means we have 17 school districts within our Travis County boundaries. You're it with respect to our criminal justice, judicial justice system. And Integral Care is also our mental health provider of choice legally. And so anything that we can do to look at the ramifications of no action is something that I think we have to take into consideration. Because as we brag about our equity, perspective, and lens in Travis County Central Health, then this all has to do, it's all interacted, it's all interrelated, and we have to look at those consequences from our children to those that go to the grave, from birth to the grave. And this is exactly a significant part of one of the disruptors in our society for a family and for children. And so I welcome the conversations, and I look forward to great plans together. Thank you, Sheriff, and thank you, Travis.
Thank you, Manager Valadez. Any further questions from any managers? Yes, Management Wani.
And this is just really in the interest of continuous improvement or possible cost savings for all of us as taxpayers, but did I hear, if an inmate were indigent before, of course, they were an inmate, and were magistrated, then they are not billed at the rate that they would have been had they been indigent, right? Is that correct? And so is that a model, is that statutory, or is that just a policy thing with the providers that you work with, or do you have negotiated rates with those providers? I'm just curious.
Can you answer that?
No, I would just say, let me just back up. So again, what we talked about is if you're indigent and you're arrested and you're taken to the Travis County booking facility, but it's determined that for medical reasons, you can't be accepted by the jail, you're taken to Seton, and then that bill is not paid by Travis County. But once they're magistrated, once they're magistrated, 5 minutes later, they need to go to the emergency room.
custody then.
If they went to the emergency room 5 minutes after they were magistrated, the county would pay those expenses to Seton. And as far as we talked about that those outside medical services, either at Seton or various specialty care providers, they're not negotiated. We don't have negotiated rates. It's in general negotiated on a case-by-case basis. We try to get the lowest cost possible, but we don't have the contracting expertise and partnerships that maybe Central Health may have access to with their partners to think of a better way to.
So it's just like the self-pay rate or whatever the rate is, the full pay, the full cost.
Well, we try to negotiate the lowest possible.
But that's afterward, right?
At the time of, not up front. Yeah.
That's really interesting. I mean, I just see opportunities, at least for that discussion to be had in, irrespective, uniquely actually, if somebody is indigent, irrespective of whether they were indigent before arrest or not. But I don't know, is that just how it is everywhere though? I mean,
well, again,
in the other counties?
The other counties, again, there's different models, but in some of the counties, since their healthcare district pays for outside care, they have a public hospital, and then they pay for inside care. And then there's some.
So presumably at the rate that the district is contracting care or providing that care.
Or providing care. There's different models. But I would just add too, as the ask is exploring the $3 or so million of outside medical care. That's what it costs the county. That may not be what it costs Central Health and Central Health partners, depending on
That's what I'm looking
your
at. I'm wondering if
relationships
that
and
might
your
transition
partnerships.
to
We
like-
would still be committing to freeing up that $3 million or so for diversion efforts that could be discussed with the partners. The best, what should Travis County pay for, right? We could put $3 million in that bucket and have discussions with the partners. But it doesn't necessarily mean that, now it could mean those expenses, obviously, for Central, could rise over time because, population
Yeah.
growth, inflation, all those various things, but.
That's just very interesting. Thank you, Chair.
Thank you, Management Wani. Mr. Giesland, do you have anything to say?
Manager Valdez has her hand up, but I'll get in line.
Yes, please.
And we're at a unique point in time, because one of the things that we do is look at what the needs are, the medical needs of our community, and plan strategically to provide for those services. And if that means purchasing additional services from providers or providing them ourselves in-house, the growing of the medical component for Central Health, or leasing or purchasing buildings, or having our own buildings in-house to provide services, that might be something that we could consider in the future, as we still have buildings on the Brackenridge track, and that is our property. And maybe this is something that in the future we might be able to look at. I know that Travis County had the Sobering Center right there on Sabine, but we have at least a parking lot in a UT Medical School building that will be coming up for consideration in '24. So if we're going to be providing services, maybe there are ways that we can work together in the development or placement of those locations.
So, well, definitely there is a lot of room for improvement. Thank you.
Coordination.
Improvement, coordination, all of it. Mr. Giesland, do you have anything that you would like to say?
Yes, just to make certain that I understand what the direction is here for the next steps in the dialogue, is that taking the comments and the questions from the board members today and then circling back around with you, Travis, to figure out, okay, this is the next level of dialogue that would need to be had. But in the meantime, I wanted to emphasize that we're going to continue to work with Travis County and our other partners in getting individuals enrolled in MAP, and these are somewhat dated numbers, but it's easily over 1,800 individuals at this point in the fiscal year that we've been able to get enrolled in MAP as they transition out of the jail. And so we're going to continue to do what we're doing in the meantime, but I think there's a lot that's been said and asked here today that we just simply are not in a position to answer for the board yet. I will point out, just as a matter of full disclosure, that as we are working through our healthcare equity what is optimization of that word? And financial sustainability plans. And there's a lot that we are doing in the community. If you think about the over 150 projects and the 30 some odd initiative buckets that are going to benefit individuals that are socially vulnerable and either have or statistically speaking may very well interact with the criminal justice system, especially as it relates to integrated mental behavioral health and substance use disorder. And so we're going to keep working on that. And so I'm pointing that out because the same staff that would, and I can pull together the work to figure out what the next dialogue is, but if the board wants to take a step towards, for example, an assessment and working with Travis County on that, with a third-party vendor and how we pay for that, that's going to take some bandwidth that right now is solely dedicated to our healthcare equity work and making sure that we're making good on our commitments to the community to come back with those plans to say, this is what we're going to do to be able to fill the gaps in healthcare. So I just want to acknowledge the questions and comments today, but also put out there what the focus is for the next several months.
Well, thank you. Appreciate that, Mr. Giesling. I think overall, the members have all wanted some additional legal research. I think that's the overarching question behind it. Can we? I think I think that is the priority and direction that we are providing you to seek us legal guidance. about this matter, and also in terms of the statistics that our members have asked or requested for in terms of demographics, numbers, and why I think their I think Manager Kitchen mentioned emergency visits, the cause of emergency visits, and there were other questions as well.
Do you mind if I just kind of give you my notes, what I think the takeaway is from Travis County, and if I miss something, y'all can
Sure.
Okay,
If
so
that's-
first is the demographic deeper dive. We've given you some information. We'll do a deeper dive. It sounds like we need to show you what the numbers of people that show Travis County as their primary residence. Again, 32% of the people don't have an address. So, but I think we can get you that fairly soon. One thing I just would mention too, that I talked about, pretrial service does a indigent assessment. That's determined, the bar determined whether or not they receive that is determined by the criminal judges. It's different than likely what Central Health's eligibility is.
Personal bond or not?
Sure, yes, but there could be an opportunity as a part of that assessment to determine whether or not they meet Central Health's indigent criteria in the future. So just wanting to put that out there. ER visit details, maybe a breakdown of other medical needs. We talked about the third-party review. I know that the legal research that's needed, and then we would commit when it's the appropriate time, and you'll have the bandwidth to be on some calls to the other county, other healthcare districts, and the other sheriff's office together to learn more about what they do and maybe some of the challenges and efficiencies they have that we don't have.
That's a lot.
Yeah, it is. No, it's a lot. And I get the bandwidth. I know it's budget time, so our office is very busy. I know y'all are working on that, but we'll definitely commit to getting the demographic data to you within the week, if not sooner. We'll start on that.
Okay, so depending on what you can provide us, I don't know if we'll have, I believe we'll have another visit with you all soon. I'm not sure when, once you're ready. And I think in the meantime, we'll do the staff will conduct their research and provide us with their legal opinion. I think that's the overarching issue within our statute. Is there anything that I have missed or has been missed that we are asking for?
If I may.
Yes, Mr. Giesland?
In response to, a partial response to Manager Kitchen's question, and I apologize for not understanding, fully what you were asking. I think there's certainly, if the board needs to have conversations with legal counsel, we can do that in closed session, but there's a policy element that's embedded in your question around Medicaid. And just a quick touch base with some of the lawyers in the room here. There's, obviously Texas being a Medicaid restricted state, there are very few instances in which an individual will be enrolled in Medicaid. However, there is a transactional situation that, and Monica, correct me on this, that if they're in the hospital, there are situations in which Medicaid may be applicable in those situations, but there's a lot of discussion around what those transactional characteristics look like at which Medicaid would kick in.
And or disability, Social Security disability.
Likewise.
Thank you.
Thank you.
Just one comment.
Quick, thank you.
Quick comment. In our Latino community, or people of color community, Black, brown, non-English speaking, you're going to find that the first place that they look at for being disproportionately inequitable is going to be the criminal justice system and the judicial system. And this goes to the very core of what we are doing in Central Health. We're looking at the medical and hospital position of our population, but it is directly related to the parents or the adults or the children that get involved in these systems. And so anything you can bring us and anything we can consider under the auspices of equity is something that I think we need to put on the table, even if there may be people that are not interested in partnering or provision of services or funding. I don't think that's going to be the case, but just in case, I'm telling you, I would be an advocate under those auspices, under those qualifications. Thank you.
Thank you so much, appreciate it. Thank you all for coming here and for this discussion, and we're committed to working with you all and collaborating on this issue. That was really a meaningful thing that we all should attend to. Again, thank you for your service and for your work. And at this moment, we have no further questions. I will adjourn the meeting. Thank you all.
Thank you
Meeting
very much.
adjourned.
Thank you.
Thank you.
Now you have to have a motion.
Oh, sorry. Because there was none. Do I have a motion for adjournment?
A second.
We have a first and a second. All in favor?
Aye.
Aye. Meeting adjourned. Thank you.
Good meeting.